Hey everybody, this is Dr. Nick with the Springfield Wellness Center, and this week we're going to be talking about nerve pain. So nerve pain is a problem that a lot of people deal with and can be caused by a lot of different problems. Today we're going to focus mainly on joint issues that cause nerve pain as well as muscle issues that cause nerve pain. So first, just to explain the nervous system real quickly, the brain and the spinal cord are what make up your central nervous system, and that's kind of like the highway of information in your body. So it's very sensitive and it's delicate, so it needs to be protected. So the skull protects the brain and the vertebrae protect the spinal cord. Now when the spinal nerves exit the spinal cord and then exit the vertebral column, they go out to the body, and that's what controls all of the actions in the body, whether it's your muscles moving, how you feel, or your heart beating or your lungs breathing. So it's really important for these lines of communication to stay open between the brain and the body. Now, the two things that we're going to talk about today are if there are any spinal issues that are causing nerve pain or nerve interference, which will then cause nerve pain, and also any muscle tension that might be causing that. So with the spinal conditions, and that's what we focus on mainly here in the office, are going to be any type of misalignments. So when something gets out of a line, your body's going to try to naturally move it back into place because that's where it wants to be. But if something happens, whether it's a car accident, a fall, sitting at work for 8 hours every day, if this gets out of alignment and it stays out of alignment, until you get that adjusted back into alignment, which is what we do as chiropractors, is try to put things back into a line and get things moving the way that they're supposed to. If that's out of a line, you can see that this nerve comes out in between these two vertebrae. If that hole starts to get impinged on, if that nerve gets pressed, that's going to create a problem between the brain and wherever that nerve runs to. So the pain will show up wherever the nerve runs out to. So this is probably the base of the cervical spine. So that would cause problems into the trap and also into the shoulder itself and possibly down into the arm. So when we take the pressure off by adjusting that vertebra back into alignment, you can see that the hole opens back up, the pressure is gone, and then the nerve pain is relieved. Now the same idea can be used for muscle tension. So all of your nerves run out to where, like take for example this nerve. This nerve is going to run down your shoulder and into your arm. Well, that nerve will pass through a lot of different muscular structures to where if there's any tightness that's pressing on that nerve, it's going to create that nerve pain. So our goal in the office, not only with the spinal column, but also any type of nerve impingements that might be going on with a muscle, if that muscle is causing the problems, we need to make sure that we're doing some soft tissue work to relieve that tension, taking the pressure off the nerve, which then relieves the nerve pain. So really nerve pain is more of a symptom, not really a cause. What we want to do is get down to the root cause of what is actually causing the nerve pain, and the only way to really find that out is by getting a full exam and having us take a look at what's going on. So if you are suffering from nerve pain, make sure you comment below. You can give us a call here at the office at 726-0422. And if you know someone that's dealing with that, make sure you tag them or share the video with them. And you can visit us over at wellnessspringfield.com, where you can find out more information about what we can do for you. I'll see you next week.